declare that Prof. Amir is my supervisor. Okay, all right. Okay, let's dive deep into the pharmacotherapy, and I believe that's the reason why exactly you are here today on how to become a cessation service provider. Am I correct? Okay. Now, hopefully, at the end of this module, you are able to describe the principles of pharmacological management, which includes NRT. Okay? And then you are able to evaluate and apply the intervention for selected group of patients. Okay? Whether they're in their pre-contemplation phase, or they're in their contemplation phase, they are pregnant women. Okay? And then you are able to identify and manage symptoms of withdrawal, which Prof. Amir has mentioned. Withdrawal is the one of the biggest setback. Okay, now to set the stage, you must be able to embrace a few things before you are able to provide cessation support. Why? Because just like, for example, you want to go to rain rave, you must be able to not be afraid of water. Correct? But if you say you want to get wet, can you go or not? Cannot, obviously, right? Okay, so first thing first, we must acknowledge that quitting by willpower has very low success rate. That is why today we are here to learn about pharmacotherapy, right? Because you know that pharmacotherapy will double your success rate. I mean, the smoker's success rate. Okay? Now, all of us here, whether you run a clinic or not, you must be able to do two things. One is ask, number two is advise. Okay? The two A's you must be able to do regardless. Okay? And of course, we're going to talk about priorities later. Now, stages of change. I will not talk too in depth because later on we will talk about it. Okay, there are stages of change that occur in every one of us. Have you thought about losing weight? Yes, right? Every year your New Year resolution is losing weight, right? Yes. So do you go through pre-contemplation or not? Yes, right? Okay. Then do you go through contemplation or not? Yes, right? Okay. So same for the smokers. They also go through stages of change before they can finally quit. Okay? So we understand that it's round and round the garden for them. Okay? So for you as a cessation service provider, if you embrace that, then you will not feel disheartened. Because it's okay to relax. It's okay to go back to smoking. Once you embrace that, then you won't feel demotivated. Okay? If not, you resigned long ago already. Okay? Now, okay, so pre-contemplation is when they are not ready. Have you heard about what are the reasons or excuses they have given to you when they are in pre-contemplation phase? Tak boleh sebab kerja ni cannot attend clinic. Is it weekly? Is it? To stay alert. Is that what you mean? Okay. So pre-contemplation phase that I've heard of is like, yeah, no need to quit lah. My grandfather also lived up to 90 years old. Smoke 2 packs a day. Correct? So contemplation phase, what are the reasons? When you are in contemplation, you are ambivalent, meaning yes and no. Want to lose weight, want to lose weight. Like that. Okay? Now, what's the best way to deal with contemplation? If let's say you find that when you do the A, you ask, you find that they are in contemplation phase. So what's the best way to deal with it? How do you deal? Motivational interviewing. Gao. Okay. For me, right, if they're in their pre-contemplation phase, which later we will do more interviewing. Okay? So for pre-contemplation phase, right, it's okay. We just plant the seed and hopefully we okay. Why? Because at pre-contemplation phase, they already say that they are lactate very low, right? Then how else you want to push them to quit? Right? So you just plant the seed and leave it like that. That's all you need to do. Understand? Okay. So at contemplation phase, yes and no, right? Do you experience contemplation or not? Do you experience? Yes, right? In what situation?
Okay.
One like that, right? Okay. For me, right, it's very simple. Patients who are at these two stages is okay. For example, I give you a real life example. Okay, you go to a meeting. Okay, you just want to browse only, right? Suddenly the sales assistant comes to you, Miss, how can I help you? Then you say, it's okay, I just want to browse. So, what do you want her to say to you? Leave you alone, right? I already say I want to browse, right? But if let's just say the sales assistant say, okay, so today you want dress or you want skirt? You want blue color or you want red color? You want blouse or you want jeans? You pissed off or not? Exactly, right? So don't be that sales assistant that I say. Alright? Now, ambivalence, can you scan the QR code and tell me what you understand about ambivalence? One word only I need. Don't take my picture, just scan. Next one. Okay, so you sort of have an idea what is ambivalent, okay? So in order to progress further and stay motivated as a service provider, you should be able to embrace ambivalence in that it's okay, right? Okay, and don't be a pushy person. Just plant the seed, and one day the sun and the water, the rain, the water it, nurture it, and it will grow, and they will come and look for you. Okay? Can you go back to the slides? Okay, so you have an idea what is ambivalence. Okay, so ambivalence, when you see the patient, you always see the tip of the iceberg. Okay, they want to quit, but deep down inside, how they feel? They feel stressful, they feel fearful, they are afraid of withdrawal, they are afraid of failure. What if they pay, but then in the end it didn't happen, right? Okay, so there's a lot of feelings going on underneath, so it's okay, you need to embrace it, okay? Now this one I will not talk further, I've given you the example, right? The lose weight and the pudding. Okay, third thing you must embrace is that you need to understand that eating cold turkey does not work. Okay? One word say all, does not work. Only 2.5% will repeat abstinence at the end of 1 year. Okay? So remember, whatever situation or setting you are in, make sure you ask about smoking status, make sure you advise, and leave it as that if they are not ready. Okay? Some people also tell you, drive also can die in car accident, right? They got all kind of example. It's okay. Okay? Okay, so number one, ask for tobacco use. Number two, advise them to quit. Okay? The assess willingness, the assist, and the arrange for follow-up, leave it to those who are in the quit smoking clinic. Okay? Now, all patients should be offered. Okay? Even yesterday, the psychiatrist said even psychiatric patients should be offered. Right? Okay? And a quit date should be set within 2 weeks, not too long ideally, because why? You should not set the quit date immediately today also. You today decide to lose weight, today don't eat, can or not? Cannot, right? Same with smoking. Today I ask you 0 cigarette, can or not? Obviously not, right? So set a realistic goal, which is probably 1 or 2 weeks. Not too long also, 6 months later already hilang already this person. Okay? And you can initiate treatment while they are cutting down. Okay? Don't be afraid to start treatment while they are cutting down. It's okay. Okay, so today we're going to dive into pharmacological and non-pharmacological. Of course, the non-pharmacological part, the behavioral part, I will leave it to Sifu. Okay? So for pharmacological, we talk about NRT first. Okay? Now, who should be offered? Everyone. Okay? In short. Okay, why? Because it doubles your success rate, it manages all your withdrawal. Have you ever thought, smoking also nicotine, NRT also nicotine, why I must give NRT? Why? What's the difference between the two nicotine? Why? One is a clean nicotine from NRT. The other one has got how many chemicals you learned yesterday? 7,700 exposures, right? Okay? Now, I'm going to promote heavily. I'm not from Nicorette. Combo NRT. Why? I'm going to tell you why. Because you see, this is cigarette. Okay? High or not the big? Yes. You look at all the other population. Is it as good? No. So that is why if you just want to give monotherapy, it does not address their cravings. You understand or not? Because it does not reach the plasma level that the cigarette can give them. Okay, so this one you can visit their booth later. Okay? Now, nicotine gum. Do we have the gum? Yes, okay. We're going to circulate the gum. Okay, then we're going to do live demo. Don't take if you're pregnant or breastfeeding. I tell you first. Okay? Now, we have 2 strengths, 2 mg and 4 mg. Okay? Maximum dose per day, 60 milligrams. Okay? Now, that's when your patient comes and complain it does not work. Why it does not work? Because you did not counsel them that eating and drinking 15 minutes before is not allowed. Why? Because the acidic component of your beverages are impairing the buccal absorption of protein. Okay? So that's your duty to counsel. A lot of times it's not because the treatment does not work. It's because we fail to counsel them on the correct technique. Okay? And the common side effect that they complain usually is hiccup, dyspepsia, okay? Heartburn. Why? Because the chewing technique is wrong. Can I know anyone from the community pharmacy? I know what. Okay. Can you tell me how to advise them to chew? HQ, okay. The young ones. No right or wrong, we are learning together. Okay? Okay, very good. Thank you very much. Okay?
So, inside each pack, we have 3. So, can you like break it up and then share?
just now our friend tell us that chew roughly about 10 times, not over chew. Then you should feel the sensation and then park it. Okay? After you park it, when there's no more sensation, you take it out and chew again and park the other side. Within 30 minutes, you must throw away. Okay? Now, the issue with this is that they chew continuously, number one. Then when it releases too much of nicotine, then you get all the GI side effects. Okay? Number two is when they did not throw away after 30 minutes. Okay? Now, make sure you throw away later. Okay? Later you have to. Okay? Now, a lot of studies have shown that you use it at the highest dose for 8 weeks is already enough. Of course, the manufacturer recommends 12 weeks. You may or may not follow. Okay? In my experience, 8 weeks is sufficient before you taper down. So I usually follow the 8-2-2 principle. 8 weeks, then taper down 2 weeks, and then 2 weeks. Okay? So generally after 8 weeks, you can half the dose. Okay? Meaning if the first 8 weeks you take 8 pieces, then the 2 you take another 4, and then the last 2 you take just 1 or 2 pieces. Okay? Now comes the batch. Just now I say I'm a strong advocate for combo. Why? Because at least it tries to match the plasma nicotine level provided by your cigarette. Okay? Now they have 3 strengths, 10 mg, 15 mg, and 25 mg. Hey, I see some of you never part one keep chewing. Okay?
So guys, yeah, side effects are real. Third-hand experience.
Okay. So for those who smoke more than 15 sticks a day, you have to start with 25 mg. Okay? 25 mg patch, and then you top up with yourself. Okay? The gum usually, let's say they smoke 8 sticks a day, then I will ask you to eat myself. Generally. Okay? Now, most of the side effects from the patch is local skin irritation. Normally, how do you advise your patient to stick the patch? Where? Upper arm, right? Okay. So make sure you tell them upfront that you have to choose a non-heavy day. Okay? Whether it's upper arm or upper chest or upper shoulder. Okay, so make sure you rotate the side. Okay, this is also sometimes pharmacists forgot to tell because they assume actually it's okay. So most of the issues with the skin irritation is that they do not rotate. Okay, and sometimes they will tell you I cannot sleep at night, I got vivid dreams and all that. Sometimes it's because they never report. Because they thought I want to save money, I pay already, so I want to use 24 hours. So it doesn't work that way. You must remove before you go to bed. In fact, if you have problems with unable to sleep, you have to remove even earlier. Not every time. Okay? Now, again, we follow the 8-2-2 principle. Okay? Heavy smokers start with 25 mg. Light smokers start with 15 mg. Okay? So, if light smoker, less than 15 sticks per day, 8-4. Okay? Now, where to apply? Just now we mentioned already. Okay? Make sure to rotate. And then now the latest is the quick mist. Okay? Quick mist, I will not dwell too much also. Generally, it's 2 sprays per hour, not more than 48 sprays per day. Okay? Just now I mentioned nicotine replacement therapy is 60 mg per day. Okay? So let's just say you put that on 25 mg patch. You know how many more milligrams you play with? 60 minus 25.
Oh, 45.
35, right? 35 divided by 4 milligrams. Max teacher. 8 grams, right? Okay, so how to use the dummy is available at your please visit them. Okay? Okay, so how to choose? So now that we've learned all 3 formulations, right? So how to choose? So of course combo, patch plus gum or patch plus mist, right? Am I correct? Okay, so how do you choose? Tell me if patch is suitable for people who work in the construction. No, why? Yes, exactly. So choose wisely. Okay. How about gum? Gum is not suitable for who? Is everybody suitable for gum? No. Not suitable for those with dentures, right? Or those of you who work like doctors. Can you be seen chewing all the time? You don't tell me doctors don't smoke. Okay? Yeah. Or sales representative, right? Insurance agent. So this kind maybe quickly will be more suitable because it's very discreet. Meaning when you have craving, you use and then you keep. You know what I mean? Yeah. Okay. So the gum, I will not go into it. Okay, so non-nicotine based. So are you clear about NRT now? Yes, or? Make sure you pass the pharmacotherapy part later. Okay, so non-nicotine, what do we have? Champix, okay, very nicotine, but no longer in the distribution. As the other friends, please tell them otherwise. Okay, and then we have Cessation, we have Pharmacotherapy, and we have Nortriptyline. Nortriptyline also I couldn't find in NTCC website. Okay, so please tell me otherwise also. Okay, very neatly, just now as Prof mentioned, alpha 4, beta 2 agonist. So it's stimulate it as if you are smoking, as if. Okay, and then antagonist effect at the same time, it reduces your reward. Okay, so be sure to do renal adjustment. Okay, if the patient punya creatinine clearance is less than 30 ml per minute. Okay, so you have to dose. Okay, this one is just so you know because it's not available anyway. Okay, not recommended for adolescents below 18 as well. Okay, so common problem is of course GI side effects, and earlier on there were a lot of talk about neuropsychiatric events and cardiovascular events. There's no strong association. However, I will need to tell you that if you know the patient has psychiatric disorder, existingly, cardiovascular disorder don't start. Okay? Or you can start, but if let's say they develop any events, then you quickly refer. Okay, then bupropion is independent of their antidepressant effect. Okay? So the dosing is 150 mg twice a day, start before the exact quit date. Okay, so in Malaysia currently available is Diamond. Okay, and before you start, do check the contraindication. So those with history of seizure or eating disorder who are using other form of bupropion, which is the sustained release version, the Wellbutrin, or on other MAO inhibitor, do not start. Okay, so bupropion is not shown to be more effective than NRT. Okay, especially combo NRT lah. Okay, common side effect is dry mouth, insomnia, headache. Okay. Okay. Can you understand this slide? Okay. Let me summarize for you. Basically, the top 3, you can see here, right? NRT, placebo, bupropion, placebo, very neatly placebo. Basically, anything is better than placebo. Okay? And then bupropion versus NRT, not more effective. Varenicline versus NRT, yes, more effective. Varenicline versus bupropion, yes, more effective. Now you understand the slide? Okay, next one, more complicated. Basically, anything is better than placebo. Okay, paham? Then compare with NRT patch, only combo is better and varenicline is better. When compared with gum, again, combo is better and varenicline is better. Okay, when compared with other, when I say other means I'm talking about lozenges, mouth spray, okay? Varenicline is better, combo is better. Okay? So, to summarize this slide, varenicline is as effective as combo NRT. Full stop. Got it? Now, nortriptyline. Nortriptyline is also somewhat like bupropion. It's an antidepressant to help people to stop smoking. It reduces your withdrawal and double your quit rates. Okay, start the medication before the real quit date. Okay, and the treatment is 12 weeks. Okay, before start, check contraindications. Breastfeeding and pregnant do not use. Okay, common side effect, drowsiness and dry mouth. Okay, Cessation is extracted from Cessation laborinum. Okay, available for more than 40 years for smoking cessation under the brand name Tarbex. Okay, now again, Cessation of course is better than placebo. I just mentioned to you anything is better than placebo. Okay. Now the dosage is day 1 to day 3, 1 tablet every 2 hours, day 4 to day 12 every 2.5 hours, day 13 to 16 every 3 hours, day 17 to 20 every 5 hours, day 21 to 25, 1 tablet daily. Okay? Okay, not recommended for those below 18, renal and hepatic impairment and over 65 years. Not to be used with anti-TB drugs. Common side effects, dry mouth, nausea, heartburn. Okay, special population. Like I mentioned, pregnant and breastfeeding. For me,